Hey everyone, this is Dr. Ackerman with Active Chiropractic Care, and this video is going to go over stretches for your upper middle back and spine. So the first stretch that we need to show you is the upper trapezius. This muscle goes between your neck and your upper middle back. And how you stretch this is by taking your opposite hand and pushing the shoulder back and down while you lean away, stretching the muscle between your head and your upper middle back. You want to hold this stretch for 20 seconds or 5 deep breaths. And of course, you want to do it on both sides as well. The next stretch for your upper middle back is a chest stretch, because when your chest gets tight, it pulls your shoulders forward, which causes your upper middle back to come out of alignment. So there's two muscles in your chest that you need to stretch: pectoralis major and pectoralis minor. So pectoralis major, what you want to do is put your arm straight out to the side. You're going to step forward with your opposite leg, keep your chin tucked in, and you're going to lunge forward as you increase the stretch into your chest. Once you feel a good stretch in your chest, you want to hold it for 20 seconds and then slowly back off. The pec minor, you're going to reach your arm up 45 degrees, because those are the direction that the muscle fibers run. And then you're going to do the same thing. Step out with your opposite leg, keep your chin tucked in, and you're going to lunge forward until you feel a good stretch and hold it for 20 seconds as well. You're going to do this for both sides, of course, because we need to release both muscles so that your shoulders can roll back, which is going to allow you to hold your adjustments in the upper middle back longer and prevent you from getting subluxated in your middle back as well. Once you've released the upper trapezius and both chest muscles, then you want to perform what's known as a Brugger's stretch. A Brugger's stretch is another name for a postural reset. This is something that you can do when you're sitting at the computer every couple of hours to just reset your posture from here to here. And how you do this is by first pulling your head back and tucking your chin down and in. You're going to roll your shoulders back and down, and you're going to put your palms out facing forward and hold this position for 15 seconds. When you're done with the Bruggers, you want to let your arms come naturally down to your sides, keeping your thumbs facing forward and your shoulders back and down, as well as your chin moderately tucked in. This is your new improved posture, and this is going to prevent subluxation from your middle back from happening. Then we want to show you diaphragmatic breathing, because breathing is essential for proper alignment and proper function in your thoracic spine, also known as your middle back. So people who breathe improperly always have neck and middle back issues due to subluxation or misalignments in their spine. So teaching you how to breathe into your diaphragm is essential. In order to do that, you're going to put one hand on your chest and one hand on your stomach. When you breathe, your bottom hand should come out, and when you breathe out, your bottom hand should come in. This means that you're breathing into your diaphragm and you're breathing into your belly. If you notice, when you breathe in, your top hand, your chest is rising. That means you're a chest breather, and that's something that we need to work on. So how we do that is by focusing on breathing in and pushing your belly out, and breathing out and pulling your belly in. This is called diaphragmatic breathing, and something that's going to take time, because if you are a chest breather, chances are you've been breathing like this a good part of your life, and breathing into your belly at first is going to be unnatural, so we need to practice it. What I recommend doing is what's called 5 by 5. So you're going to breathe in, you're going to hold for 5, and then you're going to breathe out. And you're going to do that 5 times. So focus on slowing down your breathing and doing it consciously, so that eventually you'll be belly breathing subconsciously. After you've worked on your breathing, this is a great time to start stretching the muscles on the back of your spine, also known as the rhomboids. So in order to do that, you're going to reach across your body with the arm on the side that you're trying to stretch, and then you're going to grab gently behind the elbow, and you're going to pull the arm arm further across your body. What you should feel is a stretch in the middle back in this area here, and that's where the rhomboids are located, and that's where you want to stretch the most. You can also change the stretch by just the position of your hand. So you have your thumb up and stretch it like so, and then you can turn your thumb sideways and you can get a slightly different stretch more into the rotator cuff muscles and different muscles in your back as well. And lastly is the intercostal stretch, and also known as the quadratus lumborum stretch. So these muscles are the muscles that hold your ribs together, and they also get very tight from sitting all day or from improper breathing patterns or due to having misalignments in your spine, subluxation, and trauma to your middle back. So how we stretch the intercostals, or the muscles in between the ribs, and the quadratus lumborum, or the muscle that goes between your pelvis and your ribs, is by first reaching up all the way as if you're trying to reach the ceiling. And then what you want to do is you're going to stretch all the way over to the opposite side of where you want to stretch. And once you get as far as you can go and you're reaching towards the ceiling, you want to take a deep belly breath and hold that breath and then breathe it on out. So what you're doing is by reaching up and over, you're stretching the muscles in between your ribs. You're stretching the quadratus lumborum, which is the muscle between your pelvis and your ribs. And then by taking that deep belly breath, you're expanding the muscles in your stomach and diaphragm, and you're getting a really good stretch in between the ribs and the muscles between your spine and your pelvis. This is a very important stretch to do because it decompresses the ribs and decompresses the middle back, and it's also a great way to relax the muscles that you use for belly breathing. So hopefully you practice these stretches 2 to 3 times a day, especially if you're sitting at a desk. Another tool that we use in the office to help release the muscles that are tight in the middle back is called the Theracane, or a therapy cane. And you can use this for the upper trapezius by putting it into the muscle and then applying downward pressure to stretch the muscle further, or you can even use it as a way to release the muscle yourself by doing massage into that area. So that's a good way to use this for the upper trapezius. You can also use this for the chest and for the pec minor by putting the other end of it into the actual chest itself and then pressing into the chest muscle while you either stretch the muscle, or you can just use it to release trigger points into the chest itself. And lastly, you can use this end of it to get into the back, those hard to reach muscles, the rhomboids, and then pull forward to get the rhomboid muscles. And what you want to do is find any areas that are tender, and once you find a tender area, you're going to hold the Theracane on that area, and you can even do circular motions with your shoulder to work that muscle out, or you can use the Theracane and move the Theracane yourself to work the muscles out. So this is a really useful tool to either reach the muscles that are hard to reach or to go deeper into the muscles that you want to release the knots and the muscle tension. So again, this is a therapy cane. We use this here in our office with all of our patients, and it's a really great way to release the muscles in your upper middle back. Some of the best stretches for your middle back are done on the floor with a mat. The first one we're going to show you is a cobra stretch. And this stretch helps to improve the extension in your upper middle back and your lower back as well. So what you're going to do is you're going to be on the floor and you're going to be focusing on arching up while breathing in and then lowering yourself down while breathing out. So now notice, while I was in the upward position, my shoulders are back and down, and I'm keeping my chin tucked in while looking straight ahead. Those are extremely important cues to be focusing on while performing a cobra stretch. The next stretch is going to be the extended child's pose. The purpose of the extended child's pose is to stretch and decompress your middle and lower back and the muscles also along the upper middle back as well. So for the extended child's pose, you're going to put your knees shoulder width apart. You're going to put the tops of your feet flat on the mat, and you're going to extend your upper middle back while stretching your heels and your hips together. Another key focusing point is that when you breathe in, you want to focus on the stretch, and when you breathe out, you want to go deeper into the stretch. So that means as you breathe out, your hips should be coming closer together towards your heels. So again, this is what it looks like. Breathe into the stretch. Breathe out. Stretch further. Breathe in. Breathe out. Stretch further. Now another trick to the extended child's pose is if you want to stretch the side and upper middle back, you can reach to the opposite side, and that will give you a deeper stretch into that upper middle back. And then you can do the same thing for the other side as well. So those are great ways to stretch and decompress your upper middle back. Another tool that we use here in the office is the VertiBall. So just like the lacrosse ball, it's really useful in helping to release the tight muscles, especially in the upper middle back. And what we like about it is that you can attach it to any flat surface, and then you can really focus on finding the areas of muscle spasm and trigger points. And once you've isolated them, you can work them out and do the movements that we've been recommending without having to focus on the ball dropping off of the wall. You can also use it for the chest muscles as well. So once you find those trigger points in the chest muscle, then you can take the arm and move it up and down or side to side, and that's going to help you isolate and release the trigger points in the chest muscle as well. So this is a very useful tool. It's called a VertiBall. And if you have any questions on how to get them, we have them here in the office, and we'd love to answer any questions you have on ways that you can stretch your upper middle back and prevent subluxation from developing in your spine. So most importantly, remember to stay healthy and stay active.